Ayan na. Okay. So, yun yung yung una. Okay. Caseous or caseous necrosis. Next is fibrinoid necrosis, characterized by the deposition of fibrin. Okay, or a fibrin-like material which has staining properties of a fibrin. Immunological tissue injury, okay, for example, immune complex vasculitis or autoimmune diseases like the Arthus reaction, okay, or the arterioles in hypertension and peptic ulcers. Okay, this necrosis class, okay, afferent arteriole, part of the glomerulus, are infiltrated with fibrin. Ito. Arteries, okay, during hypertension, pwede yan, or inflammation ng ating arterioles. Okay? This is our role of the artery shows circumferential bright pink area of necrosis. Ito. Circumferential bright pink area of necrosis. Okay. Fibrin-like materials na nasa-stain siya like fibrin. Okay? Fibrin class are proteins responsible for clotting. Okay? So these are, ito naman fibrin-like materials lang. Pero nag-harden siya. Okay? Another is gangrenous. Okay? Gangrenous necrosis. Gangrene is a form of necrosis of tissue with superadded putrefaction, usually coagulative type due to ischemia, okay? Also lack of blood supply. Example, gangrene of the bowel and gangrene of the limb. Gangrenous or necrotizing inflammation, for example, gangrene of the lungs, gangrenous appendicitis, okay? Inflammation with different types of cells combined. So we have three types. We have dry gangrene, wet gangrene, and gas gangrene. Okay, so yan, dry gangrene. It begins with the distal part of the limb. Class, for example, patients with diabetes, okay? Ischemia because of lack of blood supply, because of super malapot yung blood, because of the glucose na nasa blood. So the blood, mahirap siyang mag-flow. Tapos yung pinakamalayong portion like the limbs, lalong-lalo na sa paa, na hindi na nasupplyan ng blood. Ito yung nangyayari. It happens usually because pag nagkaroon ng injury or nakasugatan yung portion na yon, mahirapan siyang mag-heal because lack of nutrients and blood supply. For example, dry gangrene in toes and feet of an old person due to arteriosclerosis. Arteriosclerosis naman, class, is different with yung portion na yon is yung portion ng arteries is blocked by, for example, fats or taba, di ba? So, meron ding blockage sa supply ng blood. Another example is thromboangiitis obliterans or also known as Berger's disease. Okay, again, blockage na naman yan. And the Raynaud's, I think Berger's parang wala siyang opening arteries. Raynaud's disease trauma, ergot poisoning, and line of separation is formed between gangrenous and the viable part. Okay, anything na may blockage plus sa ating blood supply will cause dry gangrene. Okay, katulad nito. Okay, affected part is dry, shrunken, and dark. Okay, black due to liberation of the hemoglobin from the hemolyzed RBCs, which is acted upon by sulfuric sulfonamide produced by the bacteria, resulting in formation of black iron sulfide. Okay. So combination na siya class, lack of blood supply, lack of oxygen, and then bacterial infestation or infection. Line of separation, separation with falling off the gangrenous tissue. Okay? Kaya nga 'di ba class, usually walang ibang aid for this type of gangrene kundi amputation. Okay? Puputulin talaga siya para maiwasan yung pagkalat ng infection. Necrosis with smudging of tissues. Line of separation consists of inflammatory granulation tissues. Okay, ito naman, wet gangrene. It occurs in moist tissues and organs such as the mouth, bowel also known as the intestines, okay? Lung, the cervix, the vulva, etc. Okay, those moist area ng body. Example, diabetic foot. Okay, wet gangrene siya. Okay, class. Ano yung, this dry gangrene? Obviously, dry siya. Ano yung difference with wet gangrene? Of course, the moisture. Wet gangrene develops due to the blockage, again, of the venous and less commonly arterial. Affected part is stuffed with blood supply or blood growth of putrefactive bacteria. No clear-cut line of demarcation may spread to the peritoneal cavity causing peritonitis. Okay, this is an example of a wet gangrene of the intestine. Okay, blockage sa intestine. Nakikita nyo class, inflamed siya. Diba? So, sa microscopy, gross. Affected part is swollen, soft, putrid, and rotten, and dark. Okay, microscopy, coagulative necrosis with stuffing of affected part with blood and no clear-cut line of demarcation. So kaya siya, pwede niya mag-affect yung ibang part class kasi walang line of demarcation. Hindi mo alam saan nag-start yung gangrene, hindi mo alam kung saan nag-stop. Okay? Kaya pwede niyang ma-affect yung ibang portion ng body. Okay. The difference, okay? For dry gangrenes, usually the limbs. For wet gangrene, usually sa intestine. Okay? Mechanism for dry, arterial, arteries. For wet naman, venous. Okay? Macroscopy, organ dry and shrunken. Sa wet, moist, swollen, and rotten. Putrefaction, limited due to very little supply of blood supply. For wet gangrene, markedly meron talagang putrefaction. Okay? Line of demarcation present sa dry, no clear demarcation for wet. Bacteria fail to survive in dry gangrene kasi nga, di ba, may demarcation. For wet naman, because it is, ano tawag mo dito? Moisture, may moist. Kaya present talaga ang bacteria mostly. Prognosis, generally better for dry gangrene. Little septicemia. Septicemia class is bacterial infection sa blood, diba? Sepsis. And for wet gangrene, generally poor due to profound toxemia. Pwede talaga makaroon ng toxemia. Another is gas gangrene. It's a form of wet gangrene caused by gas-forming Clostridia. Okay, bacteria. It's a gram-positive anaerobic bacteria. Merong toxins, di ba? For gross-affected tissue swollen, edematous, painful, and crepitant due to accumulation of gas bubbles within the tissue. For microscopy naman, muscle fibers show coagulative necrosis with liquefaction. Okay? Edematous and leukocytic infiltrate. Okay, this, gas gangrene is caused by Clostridia. Next is autophagy. Okay, autophagy is self-eating, di ba? A membrane forms and engulf components of the cell which will be broken down. Okay? So yung process, autophagosomes, cellular waste, and fuse with the lysosomes which release lysosomal enzymes and degrades the waste product. Okay? Ito example siya class ng pathologic autophagy. Okay? It happens during merong build-up ng plaque sa coronary artery. Sometimes it's due to fats or deposits ng proteins. Okay, build up siya. Since foreign siya, pero hindi ito lahat. Okay? Kakaroon ng self-eating. Okay? Now, let's go to the difference or differentiation ng tatlo. Apoptosis, autophagy, and necrosis. So for general morphology, the cell in apoptosis shrink, sa necrosis well. Sa autophagy normal because yung portion na naman ng kinakain. The chromatin condensation, positive for apoptosis, negative for necrosis. Vacuolation or the autophagosomes present in autophagy, necrosis meron din. Exteriorization of phosphatidylserine. Okay. Mostly present siya in apoptosis. Yung part ata siya ng external cycle ng apoptosis. Caspases, positive only on apoptosis. And then LC3, autophagy. Okay. I think that's the end for cell death. Okay. Okay, next, somatic death. Okay. Somatic death is a condition in which the body irreversibly loses its sentient personality, is unconscious, and is unaware of or unable to communicate with its environment, appreciates sensory stimuli, or initiate voluntary activity reflex activity is intact, as is cardiorespiratory function. Okay? Ito yung definition ng somatic death. Irreversible cessation of cerebral function, spontaneous function of respiratory system and circulatory. The medical legal study of death follows within the unit of forensic science. So somatic death or death. Diba? So how do you know if the person is already dead? So there are signs. Signs of somatic death, loss of EEG, parang sa heart, electrocardiogram, loss of ECG, electrocardiogram, and cessation of respiration. This is due to complete and irreversible cessation of vital functions of the brain. Okay? Followed by cessation of the function of the heart and lungs. Okay? So mauuna si brain. Followed by heart. Okay. Diba mauuna si brain, electroencephalogram yung sa brain, and then ECG sa heart, and then respiration. Yung tatlong yan. Without those three, you are considered as dead. Somatic death. So time since death and the body condition. So After 3 hours, less than 1 hour after death, the body warmth, nawawala. After 3 hours, meron ng patchy post-mortem lividity. So after 8 hours, lividity fully developed and fixed. Okay? After 12 hours, rigor present all over and green patches over the cecum. Nag-harden. After 36 hours, yun na. Body cooled and rigor recedes. After 48 hours, the trunk bloated, face discoloration, and swollen blister present moving maggots seen. So 48 hours after death. So these are the different conditions. So changes after death, we have rigor mortis, changes in the skin, changes in the eye, cooling of the body, and cadaveric spasm. Okay. Rigor mortis. Okay. From the Latin word rigor, also which means stiffness, and mortis, death. Okay. Stiffness of death. Post-mortem rigidity is the third stage of death, characterized by the stiffening of the limbs. Okay. Later on, we will discuss more thoroughly with rigor mortis when we come to the different signs of death. Okay. Cadaveric spasm, also known as the post-mortem spasm. Instantaneous rigor or cataleptic rigidity or instantaneous rigidity is a rare form of muscular stiffening that occurs at the moment of death. Tingnan nyo, class. Meron siyang hawak, di ba? Okay, hawak niya yan nung namatay siya. Cadaveric spasm can be distinguished from rigor mortis as the former is stronger stiffening of the muscles that cannot be easily undone, as rigor mortis can. The cause is unknown but usually associated with violent death under extremely physical circumstances with intense emotion. Okay. Usually, class, cadaveric spasm happens sa mga patient na yung cause of death nila is traumatic. For example, pinatay. Okay? O may nahawakan sila and then they get a firm grip to it, hindi na nila mabitawan. Okay, changes of death. Ito naman yung mga late signs. Putrefaction, adipocere formation, and mummification. Putrefaction, class, is a process reference the breakdown of human body after death. This is viewed as the decomposition of proteins and eventual is viewed as the composition of proteins and eventual breakdown of cohesiveness between tissues and liquefaction. Okay. This is caused by the composition of the organic matter by the bacterial or fungal digestion, which causes the release of gases that infiltrate the tissues and leads to deterioration of organs. In other words, naagnas, di ba? Putrefaction. Adipocere formation, okay? Also known as the corpse wax, grave wax, or mortuary wax. It's a wax-like organic substance formed by anaerobic bacterial hydrolysis of fat in the tissues, such as body fat in the corpse. In its formation, putrefaction is replaced by the permanent firm cast of fatty tissues, internal organs, and the face. Ito. So, because of the hydrolysis of fat, okay, necrosis ng fat, nagkakaroon ng waxy-like appearance yung portion. So, nagiging adipocere formation. And then lastly, mummification or the dehydration ng tissue. It's a direct consequence of autolysis or putrefaction, but in a sense, a competing process as a function of an environmental condition, the rate at which water evaporates from the body from exposed section of the body can be rapid enough to reach point where dehydration or of individual tissues precludes bacterial action of putrefaction. Okay. So, yung dehydration class, nauna siya from bacterial putrefaction. Yung naunang na-dehydrate yung body, kaya nahirapan si bacteria na mag-infiltrate. So, ito na yung mummification. Thus, retaining yung size or yung form ng body. Diba? Sa mga mummy. So, that's somatic death. Okay. Let's go to autopsy. Okay, class. So, autopsy class is one of body analysis of death, after death. Okay? So, autopsy is also known as the post-mortem examination performed on the corpse to determine the cause and the manner of death. From the word auto, self, and which means to see one's self. Okay? Yan. So, one type of autopsy is forensic autopsy. Forensic autopsies are performed when the cause of death of the victim may be a criminal case, often involving foul play. The forensic autopsy applies science to legal law. So we have different types of classification of death based on forensic autopsies. We have natural, accidental, homicide, and suicide. Meron ding unknown. Okay? Following an in-depth examination of the evidence, a medical examiner or the coroner will assign a manner of death as one of the 5 listed above and detail the evidence of mechanism of death. So ito na yung ginagawa. Dito na pumapasok yung trabaho ng forensic analyst. Okay? As a medical technologist, pwede tayong magtrabaho as a forensic analyst or ang nagpe-perform ito class is yung ating mga SOCO. Diba? Okay. Type of death. We have natural death. So obviously, it is caused by natural cause, used by coroners to describe the death of someone by occurring disease process or is not apparent given medical history, maybe old age or natural death or heart diseases, stroke, and genetic disorders. Accidental death, death that is often caused by mistake or in a freak occurrence. These deaths are not planned, yet can be explained by surrounding circumstances. Suicidal naman, the act of ending one's own self. Okay, these autopsies often easily identify source, cause, and other factors of death. Identified in the forensic autopsy as a cause of toxicity, firearms, and blunt force trauma. Okay? For unknown death, some jurisdictions and undetermined category may include death in absentia, such as death at the sea, say, mga missing person declared dead in a court of law, and others such as death are classified under others. Unknown yung cause of death. Maybe unidentified na yung body or hindi na siya pwedeng, hindi na siya ma-identify through autopsies. Okay? Experts who performs forensic autopsies. So forensic autopsies usually performed by a specialized medical doctor called the forensic pathologist or a medical examiner. To be a pathologist, the doctor must have a complete 4-year undergraduate program, 4 years of medical school training, and a 3 to 4 years of post-grad training sa pathology residency. Okay, for physical examination of the body is broken into 2. So we have external and internal. For external, outer layer of the body is examined for foul play. And for internal naman consists of inspecting the internal organs of the body for evidence of trauma or other indications cause of death. Okay. For external examination, okay, ito. Physical evidence, okay, sample of the hair, nails, etc. Undress examined for wounds, for example, lacerations, abrasions, and bruises. Okay. These are examined for the causes of death, okay, for foul play. Mini-measure siya, weight, and clean. Types of incisions. Okay, we have two. We have the Y and the T. Okay. Y-shaped cut from behind each ear and running down the neck, meeting at the breastbone, continuing towards the groins, most often used in cases of suspected strangulation. Okay. The T-shaped cut from each shoulders, meeting at the breastbone, continuing toward the groin, used to create a better look finished product, as this cut is not often seen. A single vertical cut from throat to groin. All cuts are, okay, malapit na naman tayo matapos. All cuts are deviating towards the left. Okay. So, internal examination. The cuts. The chest cavity is cut open using shears. The ribs are sewed away, letting them to be lifted off the body, exposing the heart and the lungs. So after that, the removal or the en masse technique of Letoul, or the removal of organs all at once. And then the en bloc method of Gon, or the organs divided into 4 groups and removed by sections. Okay? All removed organs are now weighed and examined for unusual markings of or signs. This is usually done, class, if the patient is suspected to be poison, or yung cause of death niya may be due to food or irritations. Okay, the brain. Internal examination, the incisions are made from the point behind the ear over the top of the head to point behind the opposite ear. Okay, the scalp is pulled away from the skull, creating a toe flaps, and then the front flap goes over the face and the rear flap over the neck. The skull is then cut with an electric saw to create a cover that can be pulled over to expose the brain. The brain is then cut from the spinal cord and lifted out of the skull for further examination. Okay, brain examination is done to confirm the cause of death, maybe stroke or yung ischemia, okay, lack of oxygen sa brain, or trauma, okay, due to accidents or death. Okay, the vitreous humor. The level of vitreous humor in the corpse eye tells us how long the victim been dead. The more potassium in the eye, the longer the victim has been dead. Okay, the vitreous humor contains potassium. Okay, the more potassium, the more or the longer the victim is dead. Okay, these are the different signs of death, class. First is livor mortis. Okay, defined as the color of the death. The color of death. Coloration or discoloration ng skin. Okay, at death, the heart stops working. When the heart stops working, the blood stops pumping. The blood stops pumping, the red blood cells and the plasma gather on the bottom part of the body, closest to the floor. Okay, bababa siya. So, di ba? If you are dead, nakahiga, and then the color or the blood, bababa siya on the bottom part, usually on the back. Okay? The line forms after 8 hours if the body has not been removed, or a new line forms. Okay. It is impossible to tell which was first. Okay. The thicker the line, the thicker the line, the thicker the line yan. The thicker the line, the longer the position of the body was in. Okay. Kung saan anong position kayo namatay, class. For example, naka-side view. For example, ganito. The livor mortis will appear here sa bottom part. Okay? If nakahiga naman kayo, okay, back first, of course, yung back portion naman yung merong livor mortis. Okay? Kung saan yung position nyo nung namatay kayo, That bottom portion, yun yung mag-undergo ng coloration because of the blood slipping away from the veins. Okay? Algor mortis, defined as the coolness of death. So, yung drop yung temperature ng body, is a controlled environment stating at 98.6 degrees, the body will drop 1 degree per hour. So this happens because of death. The respiratory system stops working and the body stops functioning. It is no longer moving. When taking the temperature of the corpse, you can take it in the mouth because of the muscles will be relaxed and the tongue won't stay on top of the thermometer. So the thinner people cool faster than fat people, of course because of yung insulation ng fats. Ito na, rigor mortis, stiffness of the body, shows up 2 hours after death. Okay? Takes 12 to 24 hours for entire rigor mortis effects to take place. So, yan. The eyelids are affected first. Okay? The jaw, face, trunks, arms, and legs. Kaya nga, di ba, meron tayong yung death minsan class, open yung eyes. Di ba? Because the eyelid stops working or siya yung unang naapektuhan ng rigor mortis after death. The eyelids. Kaya yung minsan, pag nakadilat ka na namatay, open din yung eyes. Next is pallor mortis, defined as the paleness of death. Tone of the body, okay, yung coloration, diba? Happens 15 to 20 minutes after death. Okay? Happens due to lack of capillary circulation in the body. Cannot be used to determine time of death, except if the body is found still with color. Okay, since diba class, the blood, umiipon siya sa bottom portion ng body kung saan ka namata. Kung anong position mo after death. Tapos, yung ibang portion class, pale. Okay. I think the last for the autopsy. Yes. Class, 3 minutes remaining. Wait lang. We have, next is cytological technique. Yan. Okay, for cytology and cytological techniques, yan. Microscopic examination of cells generally refers to primarily cells that are exfoliated from tissues, lesions, and internal organs. Tumor cells for very valuable diagnostic tool. Inexpensive, quick and easy, and involves little or no risk to the patient. Okay. So these are the different techniques class or of getting or sampling the different cells. Okay, FNA or the fine needle aspirate, fluid aspiration, or the thoracocentesis, for example, or an abdominocentesis. Okay, these are the removal of body fluids. Thoracocentesis is the removal ng thoracic portion. Abdominal, sa abdominal portion ng thoracentesis sa lungs. Okay, removal ng fluid sa lungs. Abdominocentesis or peritoneal centesis, removal ng fluid sa abdomen or sa peritoneal cavity. Solid mass imprinting, vaginal wall technique, CSF analysis, and synovial fluid analysis. Also, meron tayong tinatawag na nasal flush. So, general collection technique. So, when possible, prepare several smears. Use stained and unstained techniques. Okay? Use clean, dry slides. Okay. First is scraping. Done on a freshly cut surface. Okay. Scrape the lesions Scrape yun siya, just scraps. Scrape the lesions or the tissues with a clean scalpel blade. Place the material collected on the slide and spread. So ano yung advantage ng scrapings? May collect more cells. It's advantage naman, more difficult to collect and only able to collect superficial lesions. Okay? Kasi yun na naman ang pwede mong scrape. Okay? Superficial lesions. Imprinting or imprints may be prepared from external lesions like ulcers and may be prepared from tissues excised during surgery or necropsy. Okay. Advantage ito, easy to collect. Disadvantage, may only collect few cells and may contain contamination. Kasi nga exposed ang imprinting. Ito yung output ng imprints class. Solid mass imprints. So, kung kanina, ulcers lang, imprints pa rin siya. Ito naman class, the cut-off mass. Okay, blood dry,